Hello, and thank you for watching my presentation. My name is Alyssa Songveera, and my policy brief has been prepared for the United States Department of Health and Human Services. The public health issue for which I'm advocating for today is the need for increased surveillance and research of acute flaccid myelitis. It is a rare but serious disease of which we know very little about. AFM is described by the CDC as an illness with sudden onset of acute flaccid limb weakness confirmed by spinal cord lesions primarily restricted to gray matter and spanning one or more vertebral segments on MRI. We do not know the exact etiology, whether or not it is due to infection or due to post-infectious inflammatory processes. There have been possible associations with strains of enterovirus, but no single pathogen has consistently been detected in AFM patients. The disease primarily affects children of median age of 7.1 years, with slight predilection for boys. Studies have not demonstrated any ethnic or racial predisposition, risk factors, common exposures, or travel-related associations. Quite literally, we know nothing about AFM. And the reason I'm strongly advocating for increased or expedited surveillance and research for AFM is because in the last 4 years, we have seen markedly increased outbreaks, leaving many more children with long-term neurological deficits. This graph here shows up-to-date statistics and cases reported to the CDC up until this month, or last month, I'm sorry, October, up to October of this year. So most children have not recovered, even with a wide range of treatments that we use for other acute paralytic diseases. Even though it is a rare disease, the increasing rates of morbidity in children should be cause for alarm, warranting need for scaling up of surveillance initiatives and research. Ironically, due to the eradication of polio from the Americas, the United States has stopped routine surveillance of acute paralytic diseases, including AFM, despite international gold standards. Only after a giant outbreak of AFM seen here in 2014 did an independent organization called the Council of State and Territorial Epidemiologists propose criteria for voluntary surveillance, which the CDC has recently taken up. Thus, for an already rare disease, voluntary case reporting may be extremely limited, and the amounts of cases presented for study and research would be inadequate. So, in order to assess my proposed interventions, I've considered the following criteria. Economics and political feasibility analysis will depend on the expenditures and budgets provided by the CDC. Ethical and social considerations will depend on the balance of different ethical principles of utility, autonomy, non-malfeasance, beneficence, etc. Finally, would the intervention yield the necessary data appropriate to conduct more substantive research on AFM? So the proposed interventions and their analysis. First, we looked at the status quo, which would be to maintain the current CDC voluntary surveillance of AFM, which would maintain the current financial and budgetary plans for the 2019 fiscal year, as well as maintain current ethical and social standards. But the epidemiological data is coming in at an extremely slow trickle. So the first proposed intervention would be to increase surveillance through mandatory reporting rather than voluntary reporting. So possibly this would cause an increased financial hit to the CDC budget that hasn't been accounted for. But with that increased cost comes increased data points. More children will be screened, more possible cases under investigation will be reported to the CDC. The biggest concern, though, for mandatory reporting is that when cases are mandatory, they require patient identifiers, which may violate privacy and autonomy of these patients. Utility would also be challenged as finances would be funneled towards a pretty rare disease. Increased reporting would require increased testing on patients under investigation for AFM, possibly subjecting children to invasive testing such as lumbar puncture. So the balance of non-malfeasance and beneficence may be subject to discussion with mandatory reporting on possibly a case-by-case basis. So finally, involvement of the private sector could possibly bring in a lot of charitable public funds, thereby bypassing this administration's budgetary restrictions on the CDC. Ethically, this foregoes a lot of paternalism that is in the nature of academic medicine to take care of children with rare diseases. So this passes on that paternalistic burden from the medical community to the public itself. So that would alleviate some of the ethical challenges with screening these children. The increased public awareness would increase screenings if more people and families are aware of AFM and its presentation, which would increase screenings and funding, but possibly opens up room for observer selection and other biases within the research process. So this could possibly compromise any of the data that is brought in, even with increased case numbers or patients under investigation. And ultimately, my final recommendation involves a balanced combination of mandatory reporting as well as public involvement, at least for a temporary period. The CDC's illness reportable and notifiable illness lists are updated annually, so possibly we could promote AFM to a mandatory reportable illness for a year to be reassessed in 2019. So this would increase surveillance and research, and committees could be made to ensure ethical practices and follow up with the interventions if they're not successful. There are inherent limitations to this study, as there is no foundational data on these patients. The rarity of the disease and the lack of official surveillance system until 2015 means that there's not many data points to draw on, so the power of most studies will be extremely limited. But whether or not we agree on the balance of ethical, financial, social issues, it is clear that children and families affected by AFM need more answers, and answers which can only be provided by expediting and increasing current surveillance protocols and research into AFM. Thank you so much.